Welcome to SeriousTech, Engineering the Future, a podcast where we deep dive into the critical role of domain expertise in shaping successful careers in technology. In a rapidly evolving tech landscape, mastering a specific domain is what sets top engineers apart. Join us as we explore how domain tech is transforming industries with a special focus on healthcare, and hear from experts who have built cutting-edge solutions by combining technical brilliance with specialized knowledge. If you're looking to stay ahead in your tech career, this is the place to be. Today, we are joined by Shrikant Pandya, lead AI engineer at CitiusTech. With over 14 years of experience in AI and healthcare, Shrikant specializes in leveraging machine learning and AI-driven solutions to improve healthcare systems. He holds a PhD in biomedical engineering and has worked extensively on AI applications, including GenAI and ML ops, to drive efficiency in healthcare delivery. In this episode, Shrikant will share insights into his journey into healthcare and engineering philosophy, the current impact of AI and GenAI in healthcare, and the challenges and opportunities of agentic AI in healthcare applications. Welcome, Shrikant.
Good morning. Thanks for having me on.
Well, it's our pleasure. We have a really fascinating episode in store for our listeners today. So I think maybe the best beginning to start with is your beginning. You've had a really extensive career in both AI and in healthcare. How did you first get into the healthcare space, and what inspires you to combine your expertise in machine learning and biomedical engineering with healthcare technology?
That's a great question. So, as I was choosing my college at post high school, I had a decision whether I wanted to go into pre-med or if I wanted to go into engineering. And it turns out, in terms of the things I'm good at, taking care of people, especially as a clinician, is not something that really speaks to me. But machines, I really enjoy machines. I really love the idea of technology and learning. So I went the biomedical track. If nothing else, I could help my colleagues in the medical space and help them help people, so to speak. And initially, my most of my workflow in biomedical engineering was around actual, clinical engineering. It was wet lab stuff, a lot of math, a lot of engineering, but there was a little bit of computer science on the side. And individually, I've always been really interested in AI. Thinking machines have been really a big focus of my study for the last almost 20 years at this point, just because I always thought it'd be really fascinating to have a doctor robot. That was always the long-term vision. So during my PhD, I had the idea to use computer vision. So just about the time where computer vision was becoming truly a machine learning type application. The initial convolutional neural networks had just come out a few months prior to me starting my PhD, and using that tech for surgical guidance was kind of an unheard of or unacceptable idea for a short amount of time. But we proved it, we made it work, and that turned out to be a 7-year journey of just banging your head against the wall, which is one of the biggest lessons that I generally don't tell people to go through a PhD unless you're really passionate about it. But one of the biggest pieces is you'll learn how to just persevere in the face of just failure over and over. And ultimately, that's what gets you to even better solutions downstream.
I can hear how much passion you have for what you're doing and how you've gone into that. I want to dig a little deeper into that. What is your philosophy around engineering in healthcare?
So philosophically, there's kind of two major tracks, right? There's one track which is behave ethically when it comes to anything to do with anything to do in life, but especially when it comes to dealing with people on the other side. At the end of the day, whatever we do in engineering, especially biomedical engineering or clinical engineering, there's a person at the end of it, and that's the patient. It's not even the provider. We actually should extend ourselves all the way to the patient. And at the end of the day, whatever we design, I imagine myself at least that my parents are going to be using this, my grandmother's going to be using this. These are the people that it's going to apply to. So I want to make it as good as it can be for them. At the end of the day, they should find the most value in whatever we make. That's one part of it. That leads over to the other part, which is constantly innovating, constantly learning. Without this consistent internal push to keep learning and figuring out the new things, to figuring out how to use the new things to help people, there's a tendency to, I wouldn't say stagnate so much as just rely on the old trusty solutions, right? This has worked in the past. We're going to continue doing the same thing over and over again because it has worked previously. But it really doesn't move the needle, and it doesn't move us forward as a civilization. So that's the kind of those two tracks, like the ethics and constant learning. Those two things have to be consistent in your application. And as long as you make that a habit, as opposed to just a forced intention, as long as you make that a habit, things end up working more often, I found, than when those things aren't a focus. But fundamentally, those are the two major. That's kind of the overall philosophy of engineering for me.
You mentioned the ethical side of it and that constant innovation. How do you balance technical innovation with the ethics and the regulatory constraints that are inherent in the field? How do all those things balance together?
Yeah. So, and we're kind of shifting now towards the Gen AI piece, and one of the biggest concerns when it comes to Gen AI is the dissemination of data and like the effectively free use of data across the board for training LLM models and other Gen AI pieces. And one of those training sources has been healthcare data. And we working in healthcare data have to be extremely cognizant that whatever we do, at the end of the day, if it leaves our systems at any point, it is automatically untrustworthy by default, right? If we don't keep that mentality, then it's very easy to let things slip through the cracks. And again, that those things that slip through the cracks end up affecting people at the other end, their patients on the other side of this. So we have to be extremely cognizant where we're sending data, how we're dealing with that. And in this day and age, one of the biggest things that we've used to our advantage are two major things. First one is de-identification of data. So generally speaking, in most healthcare settings where patient information needs to be evaluated by an LLM or other kind of AI system, you don't need the patient's protected health information. You don't need PHI. I mean, besides birth, sex, age, which again can be calculated, there are different things that can be abstracted or hashed. You can ignore, like, the names don't actually matter to the AI prediction algorithm. So you can kind of get rid of all of those things. And by de-identifying, you have a large opportunity to still provide value to patients without putting any of their personal information at risk. Because we're talking right now about prediction algorithms that would help a patient in point of care or help a patient over their entire like care trajectory. So de-identification is one piece. The other part, which is really exciting, which we're working on also, is synthetic data generation. So the idea again is previously we would use different algorithms to generate data at scale, and the use cases are generally I want to test a system, right? Let's say I've built a system that works on fire records. I want to test the system, but I don't have enough actually de-identified patient data, and I won't be able to get it quickly enough to test the system before my launch. How do I deal with that? Well, I have to generate synthetic data at scale, but traditionally the problem has been veracity of the data, meaning how different is each piece of data, so you can test your edge cases, as opposed to, for example, a randomized generator, which effectively you'd have to write like the inputs. Imagine two-part generator, like I'm picking what hat and glasses I want to wear, like one of those old disguise games, right? If I have only 10 hats and 10 glasses, I only have 10 by 10 permutations of things I could do. But if you have a generator that is no longer a deterministic generator, like a program like this, you can use an LLM, for example, to do generation. But the way you do it is very important. However, the flip side is the generation can be done at scale. So now we can actually invent patients that have never existed, but carry very similar characteristics to patients that actually exist. We have a tremendous amount of control over what they show on the medical record and how the medical record looks, and we can use that to test our assumptions or test our edge cases at scale. And this is again something that's only been possible for the last 6 to 8 months because of synthetic data generation. But yeah, going back to your question about data privacy, there are tactics and techniques to get around data privacy problems, not around the restrictions and the rules. Those you shouldn't get around. You should work with those rules. Obviously, we want to keep people safe. But to deal with that, there are, like I said, de-identification and synthetic data are two major things that you can do to move the needle forward in your projects.
That's fascinating. That's so fascinating to know that there's new ways to get that information, which has always been historically thought of as, and it is so sensitive, and private, but being able to still allow the machines to learn and put good information in to learn from. That's amazing. Thank you for sharing that. And as we've been speaking throughout, ultimately it all comes down to patient care and helping people. Engineers in this space, they have a really unique role compared to maybe some other domains. So how do you personally see the role of engineers and AI experts when it comes to directly improving patient care or operational efficiencies in healthcare?
Another great question, and I think there are two general thought processes, moral points where engineers get injected into the care process. The first one is during training, and I think really worked well for me when during my training was I was in the OR, or I was in the hospital almost every single day for about a 2 year span, as I was learning what process patients had to go through for the surgeries that I was specifically designing tools for. And there is it's the difference between seeing a picture of a beautiful place like an exotic beach and actually being there, right, feeling the sand. And that difference gives you all the other data points you will need to help design a truly congruous system. It's very difficult right now in today's day and age of having virtual classes and not having people physically like present for many things to show to basically have them smell the cautery in the surgery, right? It's not a pleasant thing, but these are the inputs that really help drive your personal definition of what the solution should be or how I should help this person. And at the end of the day, it's also providing a picture of the person that you're helping, right? Until you see a real patient, in front of you who is suffering from something, you don't know what you're designing for. You don't know who you're trying to help. Once you see that, automatically you can paste that patient into any future problem that you have that you're solving for. And immediately, it feels to me at least, your solution set changes, because now it's not always just crazy ideas. Some of the crazy ideas also work, but now you have a very tangible impact that you can make for somebody, right? You can see them smile for the first time. Like that's the kind of stuff that you have to work for. And once you put that together, it becomes really easy to do the right thing, to work very, very hard to make sure it works, and to deliver things that will provide value. And those things kind of come together all at once. And that's the training part of it. Um, the second half is how I see engineers kind of changing over time with AI, and the fact that effectively code writing has become commoditized. It's no longer as difficult to put code together. It's still very difficult. You need to know what you're doing for large systems, but it's no longer as difficult to get quick code snippets built. And I'm seeing people change um, from a specialist engineer of some sort, whether front end, back end, full stack, a Gen AI engineer, right, to product engineers. And the idea is that as opposed to just knowing your one small piece of the puzzle and just being like hyper tuned with that one small piece, product engineers are going to have to know the entire product end to end. They're going to have to solve problems, help design these problems from the ground up, understand the problem statement, do what product managers do as well. But they will also be in charge of how everything connects together. And as AI generated code gets better and better in the next few years, I mean, we're already at a point where AI code is better than many human coders. Once it gets even better and it's able to autonomously just build systems at scale, those systems will be useless if you don't have somebody who knows what the impact is going to be and where to exactly leverage that the value, right? And this is what the product engineer idea is coming into. It's very slow. It's not it's a trajectory that's going to take some time to really like get into it, but Like I mentioned, this is one of the big ideas on how to succeed as a future engineer in this world where AI is commoditized in code, is to understand every aspect of the product that you're building, not just your particular small problem set.
Absolutely. Every product, every project, every innovation that's brought is ultimately impacting somebody's life, and even saving lives in that kind of a direct sort of way, or in allowing a practitioner to make the decisions faster and more efficiently. And whenever that gets talked about, and as it's been in our conversation too, AI is always mentioned, and it has a real potential to revolutionize healthcare. You've already given some great examples. From your perspective, how can AI-driven technologies like machine learning help healthcare providers deliver better care, streamline operations? Like, any more examples of that?
Absolutely. So that we have kind of two big application domains where AI is just by far and away has made a tremendous impact. The first one, just to narrate the problem statement, is effectively anything that requires an expert to review documentation that takes a long time.
Mm.
Plain and simple. Anything that requires an expert to review documentation that takes a long time can be abstracted by AI, not fully supplanted, but extracted by AI, so that so that the expert is spending more time reviewing the summary than reviewing the actual documentation. And we have a very high level of accuracy for this task. Examples of this could be when you receive a transfer request from one physician to a different one. When you have those transfer requests, the receiving office, the front staff, has to extract all of the information from the medical record. Traditionally, it's been on paper, and even today, in a fully connected EHR society, it's very normal for patients to have paper records they walk in with. And again, there's a lot of inefficiencies in the whole system. We can work with what we have, right? The extracted records are scanned. The scanned records come in. The individual in the front on the front office has to extract all the information, put it in the HR, right? And that's a very time-consuming task, right? And it's very straightforward. We know that we need the name, we need the patient's ID, patient insurance ID. We need the patient's past medical history. We have to write all this stuff down into our EHR before the doctor goes in the morning. Now, all of that stuff can be extracted and done entirely by AI without any human intervention. It just helps to keep a human in the loop in that process. Now, it seems like a small problem, but that's one example of a massive monolith of medicine, right? Medicine in general is built on records. It's built on paper records predominantly. It's built on a tremendous amount of educational material, many journals. All of those things are effectively, right, specialist focused records. And extracting the records and identifying, summarizing what they mean is something AI does really, really well. There are, of course, purists like my wife, for example, will only read a journal on paper because she just loves it that way. That's just the tactile feeling of seeing something. And I get it 100%. But in terms of speed and efficiency, we can get far more by using AI for these effectively dull tasks. There's nothing really special about just extracting medical information. It's just time consuming. We can solve those problems. By solving those problems, what happens are the follow-on effects. You have more time to do more impactful things, right? The physician has more time instead of just looking at a medical record. They look at the summary, they understand the patient very quickly. They can immediately jump into the patient. And now we have paradigms like ambient listening, where there's effectively a microphone in the physician's office that listens to you as a patient and the physician, and notes everything into the EHR. The physician just checks it afterwards. And we've had mixed reviews on different systems, but ultimately the predominant view from the patient's perspective is the physician's no longer staring at their computer screen. They're actually looking at me and they see me as a person. They're talking to me like they would a normal person. And that's a big change. That we're kind of going back to how medicine was prior to HRs, prior to the full required documentation set. Not that that's a bad thing. Required documentation keeps people safe, but going back to a place where you are doing face-to-face conversations with a doctor or with a physician, that is what inspires trust in patients. That is why robotic doctors still, to this day, I don't believe robotic doctors are going to be a long-term truth for everybody, because there is a human connection piece that is missing in most interactions that you get at the physician's office, right? When you're sick, you want somebody to hold your hand and say, hey, you're going to be fine. That's the kind of thing that you can't mechanize, right? And that's where all these other AI tools are leading us to, going back to the paradigm of a physician and a patient sitting in a room, having a conversation and talking about what's wrong, and everything happens just in the background. That's the ultimate vision of this.
Machines and technology, as it's been rapidly growing, it's amazing hearing how they are allowing for, and I know this might maybe sound incongruous, but it allows for a humanization of healthcare. Again, it allows for the humans to connect with the humans again, and allow them to do their jobs to the best of their ability, and do the thing that they love and that they went into medicine for. And with with the adoption of all of this, you mentioned use of paper still, just, implementing these systems. What are some of these major blockers and accelerators? What's the hurdles and the things that are accelerating for Gen AI's widespread adoption in healthcare systems?
The hurdles are definitely the data. Right. Traditionally, healthcare systems have gone in the last 20, 25 years, we've gone from a fully paper record system to EHRs, where we're mandated by the government to be fully electronic, right? CMS has guidelines for interoperability that has to extend to every hospital system that wants to take Medicare patients, which is everybody. It's the largest payer in the world. The amount of data that's been generated in the last 25 years electronically is monumental. It's enormous, but it was never curated properly. So now we're kind of going back and identifying that, hey, this, or I should say, let me rephrase that. It was never curated properly for GenAI because simply nobody knew GenAI was going to be a thing. It was created for people. And GenAI generally sees things the way people see things. However, people still need to see things in order, right? These records are just kind of mixed, sparse, not properly categorized. It's very difficult to extract records at scale. There's lots of problems with records the way they are, even if they are electronic. And that's just completely putting aside paper records. So basically, before the last 25 years, if they're not scanned, they didn't exist. There's a big delta there, but we still have a ton of data to work with. The problem is the formatting, how it's extracted, how it's composed. All of those things are big barriers for most systems that want to enter the GenAI space and actually produce results with GenAI. Because ultimately, to use generative AI in a useful way, you need to have very rapid access to records, and you need to be able to provide a platform for your innovators to work on top of without having to get bogged down in the data set. And if the data is where you're slowed down, then everybody gets slowed down the same way. And you end up rediscovering the same solution over and over and over again in every product team that you want to generate. So this is a big blocker for us. But the accelerator, of course, is just the value, right? How much value can you get out of GenAI? It turns out it's a lot. GenAI can effectively evaluate records, documents, unstructured documents specifically, almost as well as humans can. And where GenAI really excels is when you have to make connections between documents. It's very easy for a human, especially a trained human, somebody who's a specialist, look at different documents from different parts of their own specialty and say, hey, yeah, there's some connection between this document that could be useful, and I'm going to extract this and use this for my downstream work. But GenAI can do that across not just the specialist information, but all other domains of information, and say that what connections can I take from, for example, rocket science that I might be able to use in this patient's record that has some kind of effectively a plumbing issue. I knew a vascular surgeon who once called everything a plumbing issue when it comes to the heart and the veins, or the arteries and veins. But effectively, these are the connections that AI does far more rapidly than any human does. Simply because humans can't know everything, right? We have a limited scope, we have a limited specialization, but AI is by definition general. So we have this kind of concept aggregation that happens at the AI space that's much faster. Ultimately, the value that comes out of Gen AI is in the implementation, right? You can have the best systems in the world. If you don't have great data and you don't have good problems to put them against, it's going to fail, but it's not going to fail for the lack of trying. There's no doubt about it. Everyone's trying really, really hard to make this work. It's going to fail because the expected value is not what you thought it would be, because the problem that it was pushed against was incorrect in the beginning. So problem selection is very critical to making Gen AI value work. But it's not always intuitive what products or what problems are Gen AI most efficient for.
We've been speaking a lot about Gen AI, but there's maybe something a little more new on the scene, Agentic AI, which is where the AI systems are making their decisions autonomously. It's an emerging concept. And so how do you see this evolving within healthcare, and what challenges are we going to face in ensuring those systems act ethically in the best interests of patients?
That is a very deep question. I think it'll take more than the time we have, no doubt about it. So, well, let's rewind a little bit. What generative AI, specifically large language models, work by effectively completing the next word, and they're trained on trillions of tokens, which are effectively words that were found on the internet. Newer systems are now doing self-play. There's a lot of interesting mechanisms that are used to train large language models that are continuing to get better. And one of the big things that has kind of been unlocked in the last 6 months is what we call reasoning. And the idea is that it's called test time inference. And the idea is that when we do an initial LLM call, I ask ChatGPT for something, it'll give me an initial flash response. And that response is effectively what we call type 1 thinking, which is instinctual, immediate thinking. It'll just give us that first response that comes up. But if you ask the same question 5 times, you may get different answers 5 times, right? There's a possibility. At least one of them will be different. The problem that's happening is that there is no consistency across what ChatGPT is thinking. It is simply just a cascade of different nodes, different weights inside the quote unquote brain of the system. This is where we have the parameter count, and we're getting down the technical pathway. But the more important innovation is the reasoning part. So the idea is that when we reason with an LLM model, we are effectively allowing it to have an internal monologue. Then we're allowing it to continue saying things out loud until it gets to a point where it feels comfortable with the answer, right? And when we say comfortable with the answer, we're humanizing many of these things. But the idea is that it reaches a point where the distribution of output tokens ends up being a stop token. That's the bottom line. That's how we get to a stop condition for reasoning model. It turns out, though, because reasoning models are reasoning in context, which means that they have a continuous train of thought. They've continuous as if they're just word vomiting a lot of things. They figure things out in the process of that, right? So reasoning models have gotten better. Why do I talk about this before agentic AI? The reason agentic AI is now an actual possibility in the world, not specifically in healthcare, but in the world, is that we have reasoning models that can effectively plan where they need to go. So let's step back a little bit again. Agentic AI explicitly is an AI that does not need human intervention to complete a task. That is the textbook definition of what agentic means. Is it's having its own agency, which means it has its own capacity to plan and execute actions based on an input of some sort. The way agentic AI is perceived in public is that it's just a magic, it's a magic system that can just do whatever you want it to do at any time. And that's not strictly true. The idea with agentic AI is that we want to very closely control what the inputs and outputs are, and especially what actions it can take, because those actions, if unchecked, can be very dangerous, especially in AI. And this is where we get to the central point of your question is, well, how do we use agentic AI? What does it mean for healthcare? And the answer is that agentic AI can be used for many non-patient facing or non-patient impacting roles in healthcare, where effectively they're doing document review, as we mentioned before, where instead of just searching previous documents, you may search previous documents and search the internet for other journals that may support a treatment plan or may dispute a treatment plan, and have effectively the agency to go out and find more information in order to help a treatment of some sort. Like those things are very, very useful. And we are already seeing things like deep research, which is in essence an agentic research assistant with GenAI. Um, and again, the big piece of that is the planning perspective, which is only coming from the reasoning perspective. So agentic AI in healthcare is generally considered, and I personally consider it to be something which is not a immediate path forward for healthcare, mostly because of that lack of oversight in action. There is an intermediate step, which is human in the loop paradigms, where the AI will effectively plan what it wants to do. It will build out the rule set, build out the specific tools that it wants to use to execute on that action. And before it executes anything that could be perceived as dangerous, and we can make that perception threshold very, very low, say that anything that could even change the record is considered dangerous. Have the human in the loop to allow or say no to that. Right. And right now we have there's an IDE called Cursor, and I think GitHub Copilot is something very similar. These are code writing IDEs where you have an agentic mode. And in that agentic mode, you can approve or deny any changes that it makes to your code. And that's exactly what I mean by human in the loop. That's very, very important to do. So agentic AI today is not, it's not regular, it's not really possible for agents to completely be autonomous at this point, make their own decisions and execute on those actions within healthcare, simply because of the dangers of getting it wrong. Right? We have a very, very low threshold of what we can accept going incorrectly. Right? We have to have a very high percentage accuracy, high reliability rate, and a stochastic system is not going to have that yet, unless you very tightly couple the problem set that it works on. So if I, for example, if I only had the agentic AI do one thing, and again, agency means it does its own planning and its own execution. But if I say you are only allowed to do one thing, one small thing, then you limit the effectiveness. It's not an overall bad thing, right? You can obviously test on a very small problem over a large period of time and say, here's 100,000 iterations, do the same thing over and over, and you can execute on that problem. And then you can identify your reliability metrics over time, but there is no danger of failure. If it fails, the worst thing that'll happen is you have to redo it potentially, right? That's how you can control agentic AI. But in the general scope in healthcare, there should be a human in the loop for the foreseeable future until we have guardrail systems that are way, way more advanced than we have today, where we know that it will be able to handle any dangerous line of activity.
Shrikant, this is absolutely fascinating. If just a fascinating discussion overall, but especially it feels that we're right at a cusp of a lot of new emerging technologies, things that are rapidly evolving in technology. And for engineers who are wanting to break into healthcare AI and go down the same path that you are on, what skills and mindset should they be developing in order to exceed in this ever evolving field and contribute meaningfully to healthcare innovation?
I was thinking about this yesterday. I love this question. I've been asked this a few times before, and I feel like I've not given satisfactory answers. So yesterday, I came up with a framework of what I believe careers are going to be going forward in engineering, and effectively, it's about knowledge, right? You do one of three things: you either apply your knowledge, which is what most people do; they write code, they apply knowledge. You communicate knowledge. This is what you're doing, right? And communicating knowledge is on its own an extremely powerful thing to do. Without that, you can't really teach. Without that, you can't really learn. And the third thing is you generate more knowledge. This is one of three things you're doing in engineering. Everything you're doing is within a mixture of those three things. What I found is that there is a new paradigm for applying knowledge, which is no longer just writing code. We mentioned before that code writing has become effectively commoditized with the AI models doing a lot of the heavy lifting, writing the actual code. But the architecture, how we build systems, how we build products, all of that stuff is much more reliant on the human. Even though the AI can help you with strategy, ultimately you are responsible with your product. Right? No CEO is going to look at AI and say, "Hey, you messed up." No, it's not going to work. It's whoever's running the AI is culpable for it. Any new engineer, any person who's looking to get into engineering now as a study field, it does not strike me as straightforward for coding to be the key skill. The key skill now seems to be building, learning how to build. I would argue, and I have done so before, I would argue that you would get more value out of spending a summer building products, just randomly building stuff. Because of course, code is easy. You don't need to spend a ton of time building code. You need to spend a ton of time with the research, understanding what the market is, understanding how to actually structure a business or structure a product around a person's problem, a specific problem, ideally your own problem, so you really understand the pain points. But building products, right? Spend a summer building products and use freely available tutorials, and you'll be way further along than somebody who's just academically just focused on just academics and reading out of books. The discovery of today is far more accelerated than it ever has been before, and it really comes down to your personal initiative to try new things at scale, because the risk of failure is now not even time. There was a time where even if you failed, right? If you tried, let's say you did a summer project, you failed on it, you spent a ton of time doing that, and you may have nothing to show for it except experience of writing code or experience of building something, but that's it. That's as far as you go. Today, you could build 10 things in the same amount of time because it doesn't even cost time anymore. And it's definitely doesn't cost money anymore because ChatGPT is free and you can get a lot of these other things for very, very cheap. So now the new intuition is just keep to build things you think will help people, and just do that over and over again until you find that you have an instinct to identify how to solve the problems, right? That's the real ask. Even today, as I interview people, the first question I ask is, well, what products have you built, or what problems have you solved? And explain to me first and foremost, what is a problem statement? Right? Do you understand the problem? Because it's so natural for, especially in academia, to get focused on here's what I'm doing, not what are you solving for? Because what you're doing is probably not even pointed in the right direction in some cases, right? And you should ask those questions, like, why are we not doing the thing that's pointed us in the right direction to solve this problem?
Right.
So going back to your question, what should people do, or what should new and emerging engineers do? Build a lot, build with friends, build for your community. I would be very shocked if in the next 5 to 10 years we don't see just incredible grassroots solutions to just general problems, right? Like food scarcity, like energy scarcity. These problems will be solved not by major corporations, but by individuals who are feeling the pain and now have access to tools that are just unbelievably smarter than we've ever had access to before. Like the entire world's library in your pocket times 100, plus the engineers that built that library in the first place, right? That's what we're looking at today, and where we will be in the next 5 years will be an extension of that, which it will only benefit people who have the mentality to build. And ultimately, it should be everybody, because the human ingenuity is all about innovation. We have to keep building from the fire. We now have, we're talking over the internet. We're talking over just radio waves floating in the sky. That's magic, right? That's where we've gotten with innovation. Now we can go a lot further.
That's excellent. That's an excellent answer and direction for engineers, building, problem solving. What can you do? What can you put your hands on and dig into? I think that's a fantastic answer. And Shrikant, this has been such an incredible conversation with you today. It's been such a pleasure, and I've loved learning from you. I hope our listeners have loved learning from you as well too. I know they will have, and it's been such a pleasure. Thank you so much for your time today.
Thanks so much for having me on.
The SeriousTech Engineering the Future podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to CitiusTech's YouTube channel.